Hello again, my name is Ernest Minu. Let's settle for the details now. And we begin from the courts. The Supreme Court has, in a unanimous decision, upheld as legal Ghana's military cooperation agreement with the United States of America. The Ashanti Regional Youth Organizer of the NDC in 2018, Ernest Brojajimfi, sued government, insisting the agreement was not in the interest of the state. We'll bring you details. Joseph Akable was in court. He'll bring you details of this decision by the Supreme Court. But let's talk health now, because the Health Minister says some samples taken for COVID-19 are testing positive for H1N1. He says the virus is going to be around for a long time. He has been admonishing the citizenry to respect all COVID-19 health protocols. The Health Minister also raised concern about face masks and how some persons are disregarding the directive to use them. He wants churches and benevolent organizations to help the vulnerable. Here are highlights of the briefing that ended a while ago.
Fortunately for us in our country, the scientists are yet to tell us why we are dying, why we are not getting severely critically ill, and why even our spread is not as huge and fast as is happening elsewhere. They have told us basic things that we have to do. So what we have to learn is that we should first of all make our minds that our way of life is going to change for a very long time to come. So we need to begin to advise ourselves that to enable the scientists fight the battle to win, to enable our president's dream realized, we have to change our way of life, if not permanently, at least temporarily, to make us assure ourselves that now we don't have such problem with coronavirus. It is not killing us that much, but we are all scared to the bone marrow. Why? Because it is spreading, and we don't even want people who have been tested positive to get close to us. Yes, because we may be infected. So I'm only going to talk about the few things we need to do to allay this. The president, on several occasions he has spoken, continues to advise that if you don't have the thing very, very critical seriously for you to do, please stay at home. So this are still, after several weeks, several speeches by the president, we are still not listening. So some will just come out, no matter what. And they have told us that the disease has no legs. It moves from person to person. So if you don't stay in your home and you come out, and you have it, you get somebody else. If you don't even have it, it is likely you pick it from the streets and take it back to your home to infect others who are there. So why are we not staying at home? At the workplace, we have been asked that don't let all your staff come to work at the same time. Some companies are allowing people to stay home for 2 weeks, then they will change like a shift system so that they will get space to observe social distancing. In banks, companies that are making huge monies have accepted that let some of our staff stay at home. What is the implication? It is reducing productivity. Their revenues are going down, but they have agreed to observe that. So those of us who come out just to a chat, to sit somewhere and do kokosa, why can't we stay at home?